Abnormal bleeding, spotting, new discharge, especially if you're having bleeding after menopause. That is a definite bad sign. You must see your doctor to make sure that you're not dealing with cancer. Okay, once you've reached menopause, and menopause is defined as no period for a year, you should not have any more bleeding. Anytime you even have a little spot, you must see your gynecologist. Okay, the symptoms can come and go, and like I said, you have to see your doctor if this happens. But even if you haven't reached menopause, if your periods suddenly are different than what they used to be, okay, if it's heavier, if it's a different color, let your doctor know. Especially if you have all the risk factors that we described earlier. Okay, now there really are no screening tests for endometrial cancer. There's no screening program that you go to. You know, every woman has their pap smear done once a year, has a mammogram done once a year. Pap smears is for cervical cancer, mammograms is for breast cancer. There's no screening test for endometrial cancer because A, it would be difficult to screen for. You'd have to do biopsies of the inside of the uterus, which is not fun for most women. But the good news is that usually when women develop endometrial cancer, we catch it early anyway because of their symptoms. So if you do have symptoms, that's when the doctor has to diagnose you. And there are several methods that we use to detect whether endometrial cancer is present. We can do an endometrial biopsy, which is kind of similar to a pap smear, but rather than taking cells from the cervix, we take cells from the inside of the uterus, so it's slightly more uncomfortable. We can do ultrasounds, or we can do more invasive procedures like a dilation and curettage or hysteroscopy. Many of these procedures are done in the operating room because we have to open the cervix to get into the uterus. Okay, a pap test, like I said earlier, which is a part of a regular checkup, will not always detect endometrial cancer. Sometimes it will, because some of the cancer cells can shed into the cervical vaginal area where we can catch it with a pap smear. But many women with endometrial cancer will have a normal pap smear. So if you have a normal pap smear, don't think to yourself, oh, I'm okay, everything is fine, I don't have any gynecological problem. Okay, that's not true. Next slide. Next we'll go on to ovarian cancer. We have 3 cancers to go through, so I want to go through them quickly. Cancer of the ovaries is a disease that affects either both ovaries or one of the ovaries, and the ovaries are those 2 glands that I showed you right next to the uterus. Okay, ovarian cancer is a bad cancer because most of the time when we find it, it's late. There's about 22,000 new cases of ovarian cancer diagnosed each year in the United States, and it's the 5th leading cause of cancer death. Okay, and the ovary is a complex gland. There are many different cell types in there. The most common cell type of ovarian cancer is epithelial ovarian cancer. That's the lining of the ovary, the outside. Okay, and like I said, it's often detected in advanced stages. And when a woman is diagnosed, her overall survival rate, 5-year survival, that's how we usually measure, survival. After 5 years, once you've been diagnosed, what is the likelihood that you're alive at that point? Okay, and it's only 20 to 30%. Okay, which is bad. And there's active research into looking into methods of detecting ovarian cancer early. Unfortunately, we're not there yet. Because we do know that sometimes we're lucky, we catch it early, and if we do catch it early, the cure rate is much better. Next slide. So again, epithelial cell cancers, that's the cancer that covers the surface of the ovary. 85 to 90% of the ovarian cancers are this type. Other types are germ cell cancers. They're, like I said, are more rare. They're the cells of the ovary that develop into eggs. And it's more common, the germ cell tumors are more common in younger women, and it's usually highly curable. In addition to stromal cancers, they're the ones that are part of the connective tissue of the ovary. Again, on the inside, they connect different types of cells together. If you have a cancer of stromal cancer, that's also highly curable. Next slide. But the epithelial cancers are the bad ones. It usually happens in your late 50s or early 60s. And some of the risk factors is a family history of breast cancer, ovarian cancer, colon cancer, or endometrial cancer. That's very important. Okay, probably 10% of ovarian, 10% of ovarian cancers actually have a specific gene mutation that patient has that increases their chance of the cancer. But even if we don't find a gene mutation, there is a lot of genetics involved in ovarian cancer. So it's very important that you know the history of your family, that you know that when your daughter, you happen to have cancer, and your daughter is 10 years old or 15 years old or 20 years old, that you tell them that you have ovarian or endometrial cancer. A lot of women don't like to tell their daughters that they have cancer. They don't want to scare them. You know, gynecological cancer is a very personal thing, but it's important for your daughter or even for your son to know this, because that is important for their health later on in life. And it's important that you know your family history as well, and let your doctor know. And especially nowadays, when there are specific tests that we can do to check for your risk of cancer, your family history is very important. And not only that, if you are found to have a cancer gene mutation, for example, the BRCA1 and BRCA2 genes, these are well-known genes that if you have a mutation in it, increases your risk of cancer, ovarian cancer, breast cancer significantly. And there are things that we can do to reduce your risk. So it's important that you know and that you seek out this test. Okay. Other risk factors include not having any children, infertility, and endometriosis. Next slide. Women of any age can develop ovarian cancer, but like I said earlier, it increases with age. And more than half of cases happen in women over age 60. And it's uncommon in women under 40. And like I said earlier, 10% of ovarian cancer occurs in women who have gene mutations, BRCA1 or BRCA2. If you have a BRCA1 gene mutation, you have a 45% lifetime risk of getting ovarian cancer. If you have a BRCA2 gene, you have about a 20%. That's a much higher chance than that of the general population. Breast cancer, I'll let Dr. Coomer tell you, but 80%. That's huge. And like I said earlier, blood tests can be done to check for these mutations. And the testing is recommended based on your family and personal history. And you can go and do it with your gynecologist, you can do it with your breast surgeon, with your medical doctor, or even go to a genetic counselor, and they can do it for you. And they're readily available, they're very easy to do. Now you can do a BRCA mutation without even a blood draw. You just put some scope, the mouthwash, then you put it in a cup and you send it out. Very, very simple. The results, on the other hand, are not so simple to interpret. Next slide. Okay, symptoms of ovarian cancer. We spoke about this a little earlier. They're very minimal to no symptoms, and that's why we usually find it late. Okay, but if you ask women that have ovarian cancer, you really go into it and say, did you feel this or did you feel that? Most women will tell you that they did have some vague symptoms. So it's very important that all women know what these vague symptoms are, and if you're having these vague symptoms, let your GYN doctor know. More importantly than that, go and see your GYN doctor. Okay, I can't tell you how many women I see who, as soon as they're done with their childbearing, don't go to their OB/GYN. You have to go to your OB for your, to have your baby. But once you have your baby, you don't really need to go there anymore, or so you think. You don't get your Pap smear once a year, and this happens every year. I see multiple patients that have a problem. I ask them, when was the last time you saw your gynecologist? Oh, 20, 30 years ago when my last baby was born.